What's going on, everyone? Welcome back to my channel. For those of you who don't know me, my name is Josh, and I like to make videos about mental health, talking about men's topics, my journey, sort of in hopes of kind of um, sharing some vulnerability or providing some type of insight, maybe for anyone who's watching this who's kind of struggling or going through something. So I've been kind of trying to figure out what I wanted to talk about next. And, I know a common theme with some of my past videos has somewhat touched, the last video touched on sobriety a lot. And, I specifically mentioned in that video how sobriety, didn't change my life. It helped it. But as you're going to see with the title of this video, we're going to talk about, ketamine therapy. And, my journey with ketamine and, how it did save my life. And, I don't use that phrasing lightly, I think there's been a lot of things that I've trialed, and I've tried out in my life going through my mental health journey. And I think all of those and all the individuals in that area have contributed to kind of saving my life, because at one point I was grasping for straws, and, I really wasn't sure if I was going to be around much longer. I didn't have that drive. So I want to talk about ketamine, because for as much medical information that there is that's out there regarding ketamine, the world around ketamine therapy is still kind of new. So this video isn't going to be like medical advice. It's not going to be a medically informed video. I have some understanding of it, but I want to just preface this by saying, like, nothing that I'm saying in this video is professional medical advice. This is my personal experience with ketamine, some of the things that I've learned. Everything that I'm pretty much going to share is very surface level information that you can find on the internet. But I just want to kind of walk through my journey, because ketamine was my introduction into, I guess, what you could consider like the hallucinogenic therapeutic world, though to some degree it's not really a hallucinogenic depending on how it's administered. So I guess we'll just start with, when I was in kind of the deepest funk of my depressive state, and I was extremely suicidal. I was on different types of medications through the VA. I was on, I think I was on like Wellbutrin, which I think is Buspar. I was on sertraline. There was a few other medications that I had trialed, and the thing with the VA and with a lot of medications is you have to be on these dosages for a long time. You have to trial them. If they don't work at that dosage, then you have to change the dosage. And I was kind of in a rush. I wasn't feeling any positive benefits from the dosages I was getting, and I didn't feel that my practicing team that was helping me within the VA was really kind of being aggressive and trying to change the dosages. And that's not me saying like they're, like idiots or anything like that. It's just, I think when you're the individual who's in that headspace, it's hard to understand why people aren't acting as fast as you would like them to. And part of that was ignorance on my end, maybe just not knowing the full diagnostic process. But anyway, I had become extremely aggressive in trying to research and find alternative methods to treating depression and anxiety and some of the things that I was going through outside of just Western medicine. and I think I had stumbled across a Reddit page that talked about ketamine therapy, and I had no previous knowledge of ketamine, and I had read a lot of things about it that people said that the immediate uh, relief that you found was incredible. It was, much faster than any of the other types of modalities that were used for treatment. And obviously for someone who was in that headspace, that was really intriguing for me. So I kind of dug into it some more, and luckily in the area that I live in, there was a few facilities that administered ketamine. Now there's there's a few ways that ketamine is administered. So to I guess we'll take a real quick step back. Ketamine as a medical substance has been used for a really long time. It's been used as an anesthetic in medical procedures for a very long time. It's heavily studied and understood. It's very safe in an anesthetic process. I don't know if that's the right word. It's so safe that they use it often on children when children are getting procedures done. It's used with animals often. It's just a really safe uh, anesthetic substance in that type of area. What it's not studied heavily in still is in the therapeutic process. And the therapeutic process, there's three ways of administering it. There is sublingual, so you can take it through like an oral administration, I believe, where you just kind of let this like tab or this lozenge kind of sit in your mouth. There is an injection where you can get it administered through like a shot in like the arm or the leg or something like that. And then there's intravenous, which is an IV administration. Now, all of these modalities or these ways of administering ketamine are all effective, but the intensity of your experience and how efficient it is does vary across those three areas. The other thing is that there is an FDA approved administering way through a substance called Spravato, or it's like official way is called esketamine. That's a nasal administration. I'm not going to talk too much about that. That is an FDA approved route, like I said. The way that I got it done was intravenous, and so IV. And the one holdup with a lot of these routes is that they're not covered under insurance, and they're really expensive. But I knew in my head I needed to do intravenous. I didn't want to do a shot. I didn't want to do a nasal spray. The VA does approve Spravato, but it was like a lengthy process, and they already weren't kind of clearing me for some other things. So I kind of had ruffled the feathers with the VA, and I just didn't really feel like they were probably going to be working with me too much in regards to anything outside of medicine. So I reached out to I reached out to a clinic, and they basically had this deal that there was some company they were going to be working with, that if I allowed them to document my process of going through ketamine therapy, they would provide the first 6 treatments for free. Now, the way that intravenous ketamine therapy is administered is that usually the dosage, the plan of treatment is 6 sessions, so 6 IV sessions over the course of 2 weeks typically. So what they'll usually do is about 3 sessions a week. The sessions last, you're under the IV for about an hour, so it's intensive. And I'll kind of dive into what that experience looks like, but something felt off. And I didn't really want to expose my experience for some like movie production, even though I understood that it would probably bring light and it would bring light to this world. I really wasn't in a place where I wanted to air out my laundry for the world to see, or for anyone to see. But there was another clinic that kind of they did ketamine, and then they also did it was kind of like a boutique med spa. So they did ketamine, but then they also did like facial rejuvenation and IV supplementation and certain things like that. And it was a medical doctor who ran it, a nurse that was with him. And my wife had actually reached out to them via Instagram and kind of wrote them this whole thing about, what we had been going through. And God bless them. They reached out pretty much immediately to her and said, we offer this scholarship program essentially where we will do veterans their first 6 sessions for free. And I remember I was like laying on the couch, and she came in from the room and just showed me the message exchange between them on Instagram. And I remember we both just kind of started like crying, laughing, because we weren't experiencing a lot of good luck. We were both really in a rough place with what was going on. And it just kind of felt like this was the first door opening, of some good news. So we had gone in about a day or two later. We met with the doctor. He kind of asked me some questions. We did, a light evaluation, and he was a vet. He is a vet. And I think my story really has resonated with him. And he obviously understood the impact of ketamine. He had seen it work. And he said, let's do this. He explained to me the process and what was going to happen. And I think it was like 2 days later, I was in there for my first session. Now, this is where things kind of get weird when I think people get held up with ketamine, is especially the intravenous route. Is the intravenous route is much more intense. And I use that word because I don't want to scare people with it, but I feel personally that if you are in such a severe place, that the intravenous route is the route you need to go. Because in order for ketamine therapy to work, you have to sort of go into this limbo state. And that's what ketamine therapy does. It's administered at a dosage based on your body weight. And again, I'm not a medical expert, but my understanding is that they take your weight, they take into consideration your age and your sex, and they create a dosage that fits you appropriately. And that dosage is at a lesser dose than what you would receive if you were to be getting a surgery and receiving it for anesthesia. So it puts you into this sort of limbo state where a lot of people say you disassociate. And that's a scary word, but essentially it's kind of like you know that you're existing in the room where you're receiving it, but your mind isn't there. And that's super important, in my opinion, in order for you to be able to experience what ketamine therapy is supposed to do. Now, you may be asking, okay, well, what is the point of ketamine therapy? That's the part that's still a little unknown, and they're still doing a lot of researches. But the kind of the theory and the belief behind it is that ketamine therapy, the drug itself in that state, is supposedly able to induce neuroplasticity within your brain, which, to kind of a caveman way of explaining, I guess, is like remap certain neural pathways to induce new ways of thinking. The best way that I've heard it, and I still don't know if this is the best way, but the way that my doctor who administered it to me explained it to me this way. He says, you know how when you're skiing, or if you've seen someone ski, they create those slaloms in the mountain, and they're like pathways that you go down. Well, when those are created, you know that that's a safe way to go. That's a safe way to traverse down the mountain. And that's sort of what your brain does when it develops certain thought patterns over time. It develops these ways of thinking, and it knows that those are either safe or not safe, and it sticks to those. Well, what happens is when we get stuck in those routes of thinking, we don't know how to get out of them. And what ketamine is it's sort of an avalanche that rides down your mountain or your brain, and it wipes those pathways clean. Now, what it doesn't do is it doesn't all of a sudden create a new way of thinking that you hadn't thought of before. That's where kind of the second phase of integration comes into play, which is all on you. But the ketamine kind of wipes all of those things away and allows you to kind of feel relief in a new way of thinking. Now, it doesn't eliminate those old thoughts or those old ways. It just kind of gives you a new opportunity to breathe. And that's really, I think, what I felt most was after my first session, I just felt this immediate sense of relief. I can't even really describe. Well, the one way I described it during the session, afterwards, I called a ketamine session like an orgasmic bliss, because it's just so weightless in a way. I think is probably the best way to put it for me. It just was incredibly relieving during. That doesn't mean that it was always easy. There was definitely a lot of crying and emotional experiences that went up. And I think that's what kind of scares people, is this feeling that you're going to encounter certain scary or difficult memories that you don't have any control over. And that's sort of the point. And I think if you're at a place where you're really ready to give up on life, for me, I legitimately, this is how I went into my first ketamine session. I said, I'm already ready to die. I don't want to live anymore. So if I die under the IV treatment, it's a win. If I come out feeling better, it's a win. I didn't feel like I could come out feeling any worse than I already did. So I'm just trying to use that to put in perspective kind of how bad I felt at that point in time. So I'll kind of talk now. I guess we'll just switch into kind of like what the sessions looked like. So, there wasn't really any real, like, you can't eat or drink. They did say, try not to drink a ton of water or coffee an hour or two before the session, just because you're getting a bunch of IV fluid pumped into you. And often, you kind of get this experience to have to feel the need to urinate during the session or right after. It's pretty common. So they just want to eliminate as much fluid in your body. But there really wasn't any type of restrictions. Obviously, they say if you're on any substances, like you're using any drugs, not medication, but, like marijuana, cocaine, any type of illegal substances, try to refrain or become absent from them for, probably a week or two before, just to give your mind a clear space. But actually showing up at the clinic, and this is obviously going to look different for every clinic, but my experience was, the one thing that I really gravitated towards about the place I went to is it wasn't a medical facility. It wasn't sterile. It wasn't white lab coats. It was a very kind of like holistic, warm place. So I went in there. I saw the doctor. I went into my treatment room, which was, there was a recliner chair, and they had, like salt lamps and some light music playing, and they lit some sage, and they kind of saged the room to kind of empty any negative energy that was in there. And I'm trying to paint for you like kind of what this world is, at least from my experience. But it was a very welcoming place. And they started hooking me up to the IVs, and I was in the chair, and I had a blanket, and they had a sound machine in there that played specific type of music to help kind of guide you through your journey. And so that was really nice, and it's really useful. And then, they start the session. They kind of say, what's your intention? They want to set intentions for you as you go under. And I told him, I was like, I just want to feel better, like whatever that means, just I want to stop feeling like shit. And then they cranked the machine on, and I was reclined in my chair, and at my feet to the left of me was the doctor, and to the right was the nurse, and she was on a laptop kind of taking notes, and I guess putting in notes in my chart and monitoring some of the vitals, I guess. But they were both there, and they were both in the room with me the entire time, and that felt good to me. They also had a therapy dog who was awesome. He was in the room, and I think a lot of people go through these sessions and they get abandoned. The doctors walk out of the room and they just leave them there, and I don't like that, because it is a nerve wracking. You don't really know what you're going to experience or expect, but having them in the room with me, it felt good. They basically just kind of closed their eyes the entire time and kind of sit in that space with me, but they also were awake. Obviously, they weren't sleeping, but they would sort of like grab at my shin and kind of grab my shin if they felt me tensing up, because I could feel people, like I could still feel their touch. So feeling them kind of grab like my shoe or my shin, or if then maybe they'll grab my hand and squeeze a little bit, that kind of reassured me that someone was there. I was okay. My head wasn't in the room, but my body was still there. They were still there. I was Gucci gang. So, I always say the first 10 minutes are kind of the best. I had an eye mask on, there was music playing, and I was reclined back in this chair, ready to go on my 45 to 50 minute nap. And the first 10 minutes are what I explain as the orgasmic bliss, because you just kind of go weightlessly numb, but in like a good way, like you don't feel anything. You kind of feel like you're floating in the chair. And I always felt like I was getting sucked down into the earth. And then from there, it does what it wants. I don't necessarily, for me, I never had like vivid memories. I never had a lot of colors. It was weird. Like, I don't know how to explain. You would feel colors. You wouldn't necessarily see colors, but then there was times that I saw very bright flashes where I literally thought someone in the room had turned a light on, but no one did. But I could make out shapes, I remember within my first 6 sessions, I remember I had this vivid feeling, emotion that I was observing this like emergency room, but I got the feeling it was where my mom had given birth to me, and I was kind of observing from this like architectural 3D fishbowl perspective. It was really weird. And I just got this vibe that like that was my mom handing me off to my wife to now sort of be the woman figure in my life. That wasn't said in the memory or that experience. It wasn't seen. It was just a feeling I got. There was times that I'd be flying over different countries kind of in space, like from a top-down bird view perspective. I always saw a lot of like big cogs and gears turning, and sometimes I always envisioned that was like the ketamine actually working. Like it was like showing me like, hey, we're turning, we're making things connect and work, and we're plugging things in. And there was some really emotional experiences where I would fall down into this like dark pit, and I would just feel cold and dark. It was just the most black, dark feeling you could have. And I don't want to necessarily call it an ego death, because I think an ego death is a little more hallucination. This wasn't exactly a hallucination. It was more of just a really dark, cold feeling. But then I would get sucked and pulled back up and then fly out into this beautiful, bright white light, that was warm and comforting. And every session was different. Some sessions were nothing. Some sessions I would come out and I couldn't remember a damn thing. But I always felt better. I always left the session and was like, I felt relief. Now, all of that to me was great. The ketamine therapy experience, the team that I had, the opportunity that I had saved my life 1000%. And I owe my life to that team and what they did, because that stuff's really expensive, and just the care that they gave me and my wife through that, it's hard to kind of explain unless maybe you've had a similar ketamine experience. You understand how positive and relieving it can be. I understand not everyone does, and I understand it's not going to work for everyone, but I don't think I would be here today if I hadn't gone through that ketamine experience. Now, the second phase that I kind of touched on earlier is the integration phase, and I don't think integration really has to be overly complicating. In my opinion, integration means that you need to kind of absolve yourself of any negative habits or patterns that you used to do, because again, the ketamine is just wiping the slate clean for you. If you are, struggling with alcohol addiction and you go back to drinking, the ketamine's not going to be able to fix your alcohol addiction. It may relieve your desire to drink, but if you go back to drinking, you're going to run into the same problem. If you're dealing with anxiety issues and, you're not trying to put yourself out there. Let's say you struggle with social anxiety situations, and you're in this sense of relief, but then you go back to being a hermit in your home and you're isolating and you're not trying to get out there and even just be out in society. Doesn't mean you have to be interacting with people. You're not gonna get better probably. You may feel better for a while, but ketamine's not a silver bullet. It's just, in my opinion, a bullet train to get you from one side to the other, but you still have to stay on that other side. You still have to do work. And I think a lot of people forget that. So for me, integration was trying to, and again, these weren't things that I necessarily dealt with. It was me trying to introduce healthier, better patterns in my life that I don't necessarily stick to this day, but at that point in time, it was really instrumental. Living near the beach, after every session, I would nearly go to the beach every time and go for a walk. I tried to get out and walk more. I tried to eliminate my usage of my phone more. I obviously was sober at the time, so I wasn't drinking. I was still smoking weed a decent amount, but for the sessions, I wasn't, at least in the beginning. And that's something, if I look back, I wish I would have eliminated earlier on, was my weed smoking. I'm not saying I nailed this process. I think I did it well. But I was just trying to be more active. I was trying to put myself out there more. I was going to more events at our apartment complex that would host monthly events. I would go out more with my wife, and we were trying to go on more dates and stuff. So I was trying to reintroduce things into my life that I had sort of abandoned because of the mental state that I was in. So it's been a while since I've done my last treatment. This ketamine, the main core of the ketamine experience was a few years ago. I probably did about 14 to 15 ketamine sessions in total over the course of 2.5 years, I would say. Some of those became more maintenance sessions where it was every 3 to 4 months. I would maybe find myself in a really rough spot for a couple weeks, and I would call them and say, hey, can I come in? I'm kind of hit a roadblock. Nothing's really working. I feel like I need some relief. I would come in, I would get a session done, and I would feel better. And now I'm at the point where I don't foresee myself ever needing to go back and do ketamine. Uh, maybe once in a blue moon, I might go just to do it and kind of tap into my mind again, but I definitely don't feel like I'm in a depressive, an anxious, suicidal state where that's like an immediate necessity. So just kind of to, like wrap things up with the video, it was important for me to make this because I don't feel like there's enough personal experiences shared about ketamine journey. And I know that these videos are lengthy, and, I appreciate it if you're still here at this point watching this, but I know that there's a lot of negative talk around ketamine therapy. And there's a lot of unknown experiences with it. But if you're in a really rough place, as I always say, or if you've considered it, or if you're looking into it, I highly suggest you do it. Even if you have to front the payments, I feel like if you're really at a place where you're suicidal, there's no amount of debt you can incur that could be worth that or not worth that. So if money is a factor, I would still highly suggest maybe working with your team to see if there's any way you can do like a payment plan, or if they can give you a deal on something, because I just find this modality of treatment to be extremely effective. And I just don't think enough people know about it. And I don't think that there's enough teams of doctors that are experienced enough or willing to take it on yet. So, again, I appreciate you being here. Feel free to like, comment, and subscribe. Feel free to comment if you have any questions about my experience. I'd be happy to answer them. If you have any questions about the ketamine therapy experience, or if you're thinking about it, please feel free to reach out. I'm happy to provide any information or experience that I have to kind of shed some more light on it. And let me know if there's any other videos or topics that you'd like to see me talk about, or maybe that you want me to just kind of reach on more. And with that, I'll see you next time. Thanks, guys.